Welcome to the NP Review channel. In this video, I will talk about the muscles of the torso model. Majority of these muscles are part of the axial skeleton, but some of them are part of the appendicular system. So I have already reviewed the muscles of the neck in a different video, but here I'm explaining it again. It shows here in the image. So this is a sternocleidomastoid located anteriorly, and this is a trapezius muscle that is located posteriorly. Deltoid is not part of the axial skeleton, because for movement of the shoulder joint, but it's shown here, so I just want to discuss it here. Same thing with the pectoralis major. It is not part of the axial muscle, it is part of the appendicular muscles. And if you remove the pectoralis major, then you can see the pectoralis minor here. External intercostal muscle. So these are the ribs, these are the cartilages, these are the bones. And I don't know if you can see it, these are the directions of the fibers. So look at always the direction of the fibers. If they are, so these are all the external intercostal. So if they are going like this, so inferiorly and medially, that is external. And this is for inspiration. And internal intercostal, these are the ones that are going downward and outward, inferiorly and laterally. These are the internal intercostal. Internal intercostal, these are the muscles of expiration. I have a different video for the function of the muscles, so I will not discuss it in details here. Serratus anterior, this is the serratus anterior. External oblique, look at the direction of the fibers here. So down and in. Rectus abdominis, the six-pack muscle. And internal oblique, look at it, this is going down and out. External, internal oblique. So external is inferiorly and medially, internal one is inferiorly but laterally. There's also a transverse abdominis, but transverse abdominis you cannot see in this model, so you have to remove the abdominal muscles is located deeper. Side view of this model, you can see trapezius muscle here, sternocleidomastoid, deltoid, pectoralis major, serratus anterior, external oblique, it's going like this, external oblique, gluteus maximus, again this is not part of the axial muscles, and this is the gluteus medius, it's not part of the axial muscles, and tensor fascia latae. The posterior view, you can see this side is superficial muscle, and this is the deeper muscle. So the superficial muscle, trapezius, is this big muscle here. This is the trapezius muscle, you can see it. Deltoid, this is the deltoid. In the deeper muscles, if you remove the trapezius, you can see the infraspinatus muscle here. So this is the scapula, and this is the spine of the scapula, infraspinatus muscle, and teres minor. Actually, this is also infraspinatus muscle, by the way, and this is the teres minor, and this is the teres major. Latissimus dorsi, this big muscle that you can see. Same thing here, this is latissimus dorsi. External oblique, okay, so this is the external oblique, this one. and internal oblique very small. Okay, this is the small area. And thoracolumbar fascia, this whole area is the thoracolumbar fascia. So in this image, I explain mainly this side because this is the superficial one. Okay. Also gluteus maximus, so both sides you can see gluteus maximus there, and the gluteus medius. This is the gluteus medius here. Now if you look at it a little bit deeper, so if you remove the trapezius muscle, then you have some spinalis capitis muscle here, and then you have the splenius. The splenius muscle is moving like this. It's not shown in this model. They don't design it properly. So the semispinal is very deep, and then you have the splenius muscle, splenius capitis and cervicis is moving like this. I have it in a different video. You can see it, but it's not shown here properly. Levator scapulae. This is levator scapulae, and this is, by the way, sternocleidomastoid muscle. Rhomboid, so this is the rhomboid minor, and then is the rhomboid major. Okay? So again, they are both located deeper than trapezius muscle. Again, the supraspinatus muscle, and you have the infraspinatus muscle. Okay, so here is the same thing that I said before. So this is infraspinatus muscle. Supraspinatus is around here, but it is just behind the trapezius muscle here. And then you have the erector spinae muscles. These are erector spinae muscles, so medial to lateral. You have the spinalis muscle, you have the longissimus muscle, and then you have the iliocostalis muscle. So three muscles, medial to lateral. These are called erector spinae muscles as well. There is serratus anterior was on the lateral and anterior part of the torso, but this is the serratus posterior inferior. You also have the serratus posterior superior, but is located deeper than the rhomboid muscle, so you cannot see it here. And this is part of the latissimus dorsi muscle, so this is latissimus dorsi muscle. So this you can see only part of it. And then you have the external oblique, same thing like before. From the side view, you can see that the triceps muscle, the pectoralis minor, so pectoralis major is removed here. Infraspinatus muscle, teres minor, teres major. Okay, this is serratus anterior. External intercostal, so look at the direction going downward and medial. And this is the internal oblique, so it's going downward but laterally. Gluteus maximus is here, and then you have the gluteus medius, and then you have the tensor fascia latae here. If you have any question or comments, please write it in the section below. If you want me to cover a specific topic, please write it down. If you like the video, please give it a thumb up and also subscribe to the channel. Thank you for watching, and I have other videos related to the muscles for the lab and also for the lecture, so please watch those videos when you have time.